get started and knowing that people will also have an opportunity to watch this recorded video. Welcome everyone. My name is Kim Hindery. I am the CEO of the Child Neurology Foundation. This presentation is being shown to you in collaboration with Aeroflow Urology. And the foundation is really happy to present this webinar today because pediatric incontinence is one of those areas that across the board impacts our patients and families. And it can be incredibly frustrating. It can be challenging to find the resources that you need. And so today, Sam Eaker is going to be here to give you a little bit of insight into tackling pediatric incontinence, as well as give you the opportunity at the end of this session to ask your questions and get those questions answered. So, Samantha Eaker, thank you so much for joining us. Samantha is a board certified pediatric nurse practitioner specializing in pediatric urology. Dr. Eaker received her Bachelor of Science in Nursing from Georgetown University and her Doctor of Nursing practice from the University of North Carolina at Chapel Hill. For the last 8 years, she has been practicing in North Carolina, serving children and adults with congenital and acquired urologic problems. She's passionate about providing personalized care to and advocating for her patients. Primary care trained Dr. Eaker enjoys the continuity of care that pediatric urology provides. She grew up in New Jersey, but has enjoyed calling North Carolina home for the last 12 years. In her spare time, she's most often found traveling with her husband, playing with her 2 young children, and spoiling her Great Dane. So much in common, Dr. Eaker. We spoil my mini golden doodle all the time as
You
well.
have
So,
to. Yeah.
yes, it's the best part of life. So, without further ado, please do go ahead and teach us everything we need to know about pediatric.
Awesome. Fabulous. Again, thank you so much, Kim, for that intro. I am so thrilled to be with you all. I've got the share screen, but I didn't know if Kim, you wanted to touch base a little bit about CNF first for the first couple of slides.
I sure can. So, CNF is a nonprofit organization that serves children with neurologic conditions. And many people say, what does that mean? What is a neurologic condition? Pretty much any disability impacts your neurologic system in some way or another. So, we support the disability community and we support the disability community through the lifespan. So, I know we have child in our name. My daughter will be my child when she is 30 years old. It does not matter. So, we support our patients with pediatric onset conditions throughout the lifespan. We also support the clinicians that are working to care for you and your families each and every day. We truly believe in a collaborative approach to providing support and care for our community. You can go to the next slide. We here at the foundation have a program called the Connected Care Network. That network allows us to connect to over 100 different advocacy organizations and over 30,000 social service organizations. When you reach out to us, we're able to get you connected to pretty much anything that you need, or at least try to. If there's a gap in service, that's where it becomes difficult. Luckily for us, one of our wonderful partners is Aeroflow, so they can definitely help with those incontinence needs, and we can get you directly connected to them. So please do reach out if that is a need that you have. We also connect to over 13,000 different schools nationwide, and we collect data on what our families need so that we can really fill the gaps that exist for our community. Next slide.
Great.
And here are just 2 easy QR codes where you can either submit a request to get support. We can get you directly connected to Airflow if that is something that you are in need of today. And then also, if you just want to get connected to our family support program and get our family support handout delivered to you every single month to your inbox, that will give you new educational content every month, like on pediatric incontinence. So next
Great.
slide.
Awesome. Again, thank you, Kim, for that introduction. My name is Dr. Samantha Eaker. I am a board certified pediatric nurse practitioner, and I've had the privilege of specializing in pediatric urology for the last 8 years. I am so grateful for everything that the Child Neurology Foundation does. You guys are wonderful. I'm so grateful to partner with you guys. I've also been a medical advisor for Aeroflow Urology, which has been a great partnership, which we'll talk about at the end. But a little overview overview of today's webinar, we're going to talk a little bit about incontinence, what that means, and as well as pediatric neurogenic bladder. We'll talk about strategies to help prevent accidents inside and outside of the home, how to best respond to accidents, and how to best provide support before we do a little Q&A at the end. So, incontinence among neurological conditions can mean many things. As you know, neurological conditions is a large spectrum, excuse me. But incontinence is a very common experience for children with neurological conditions. And what's vital is to normalize these challenges early so you can help reduce frustration and shame that's often associated with this. What is needed for normal urine function is coordination of bladder and urinary sphincters to allow for proper urine storage and release. And neurological conditions and diseases can disrupt this pathway. If that happens, several outcomes can occur. Incontinence is when children or adults have leakage of urine while awake during the day. If they are having bedwetting or accidents when they're napping and asleep, we consider that nocturnal enuresis. Urinary retention can happen. There can be associated urinary tract infections. And then neurogenic bladder, which we'll talk about next, is a little bit different. Neurogenic bladder is when there are spinal issues or nerve impairment or damage that is actually impacting bladder function. So there is a neurological abnormality to the nerves that control the bladder, which can be secondary due to several different neurological conditions that can lead as well to incontinence, nocturnal enuresis, urinary retention, and sometimes even increase the risk of kidney damage or chronic kidney disease. And then there are non-neurological etiologies for the same conditions. What I would be remiss if I didn't talk about how bowel management can impact all of these as I listed above. So not only does the bladder sit right in front of the rectum, so anatomically they're very close in proximity, but the nerves are the same. So I'd like to explain that it's important that we have everybody playing good in the sandbox in the pelvis. And so we'll talk a little bit more later about how it is absolutely important that we are understanding that connection and treating both the bladder and the bowel at the same time when it comes to incontinence. A little overview, what we'll talk about strategies to help prevent accidents while at home. It's going to focus on creating consistent routines, supportive environments, and really just being proactive to reduce the likelihood of accidents before they happen. We'll talk a little bit about certain bathroom routine strategies, what to eat and drink, constipation management, and then overall using protective products to help foster confidence in management. Bathroom routines are really good first line strategies to help prevent incontinence while at home, but also while out and about. Timed voiding is one of my biggest recommendations. I usually say I want my patients, kids, and adults to pee at least every 2 to 3 hours, which is going to get you to at least 6 to 8 times while awake. However, some kids certainly can't get there or have to really work themselves up to that 2 hour interval. So start small, maybe 30 minutes, and then slowly working their way up every 45 minutes hourly to where they can go a full 2 hours without needing to use the bathroom. Using external reminders can also be very wonderful. Tell Alexa to set a timer for every 2 hours, or your Google if you have them in the house. I'd like external reminders such as potty watches, which are pretty inexpensive watches you can buy online that sometimes will make a loud sound, but there are some that just vibrate, which I really like because they're discreet. So if your child doesn't want anybody knowing they need a reminder to use the bathroom, that can be really helpful. Proper voiding positioning when you do pee is also really helpful in making sure that patients are emptying their bladder fully, which can help prevent accidents. So, if your child sits to pee, I usually say sit like you are riding a horse. Have your child sit all the way back on the toilet, legs spread wide, and even utilizing a stool or a squatty potty can be wonderful. Kids are small, so if they're able to sit and bear their weight on something, they're not going to be dangling and strengthening those glutes, core muscles, which can sometimes impact their ability to empty. Sorry, that chat popped up. Let me move this.
The chat comment was actually very good, Dr.
Yes.
Aker. It was this, our participant is a school nurse, and she said this is very informative. So thank you. This is
No,
wonderful information.
wonderful. Thank you, Kim. I don't have it on my screen, so please interject me or interrupt me if there's an appropriate comment or something I need to stop or address right away. But thank you so much. That's great. Um, and for my patients who stand to urinate, I always make sure that they are moving their waistband down below their tushy to really relax when they pee. Taking time in the bathroom is one of the biggest challenges I see with our patients. Kids are busy. They don't want to spend time in the bathroom unless maybe they're a teenager who wants to scroll TikTok for 15 minutes. Really, those younger kids, you want to try to get them to take their time in the bathroom so they can really empty their bladder fully. And if they are wiping after they pee, particularly girls, I always recommend wiping front to back, which I know many parents are constantly telling girls to do so. Intake management can also be very vital in addressing incontinence. So, not only does that talk about water and fiber, but also certain triggers. High water intake is one of the most important things when it comes to incontinence. Our kids are really, really smart. So a lot of them are like, hey, I have accidents. I don't want to drink a lot because then I won't make a lot of pee and I won't have an accident. And that's actually the complete opposite of what I want them to do. If kids are dehydrated, their urine gets concentrated. That's when it's yellow, it might be a little smelly, and concentrated urine can actually irritate the lining of the bladder and contribute to some overactivity, which can cause frequency, urgency, and accidents. So I actually want these kids to overhydrate. I want them drinking enough fluid. I usually say 90% water, so their urine is almost always clear. Kids are super visual. I don't like to tell kids to drink a certain amount of water because they usually can't even remember what they had for breakfast. To be fair, neither could I, but kids are visual. So if you can encourage them to constantly look at their pee and see what color it looks like in the toilet bowl water, we're aiming for nearly clear or very light lemonade. If it's yellow, they need to drink more. That's usually pretty easy for them to remember. High fiber intake is very important to prevent constipation. I usually say your child's age plus 5 to 10 grams daily. So for my almost 4-year-old, I aim for at least 10 to 15 grams for him. Avoiding bladder irritants is also really important. Certain things we eat and drink can actually, like I said before, irritate the bladder and contribute to frequency, accidents, etc. Unfortunately, they're all the good things in life, but I usually tell parents to keep an eye on this for their child to see if they're noticing particular trends or triggers associated with accidents. Those bladder irritants commonly include dairy, cow's milk in particular, chocolate, citrus, anything carbonated, so sparkling waters, sodas, anything caffeinated, coffee, sodas. In the South here, I have to add sweet tea in for that. Spicy foods, tomato-based products, and certain red and blue food dyes, artificial sugars, and more. Identifying these triggers can be helpful for helping prevent these accidents if we can avoid them. Also, I like to bring up there are certain medications that can cause urinary incontinence or urinary symptoms. So make sure you're checking that with your child's prescriber, whoever, depending on what medications they're on. Anxiety and distraction can certainly be contributors as well. Constipation management is arguably our best tool for preventing incontinence. Constipation, however, gets a bad rap. A lot of people get offended when we talk about constipation, even though most people could afford to poop a little bit more often than they need to. I explain that it is more of this incomplete stool emptying. Kids are busy when they're learning to toilet train, if they're able to. A lot of kids poop enough to take the edge off, but they don't get everything out. That can be normal. And I don't worry about that too much unless they're having urinary accidents, because that is one of the biggest risk factors for incontinence. So, really focusing on getting your child to poop at least once a day. I tell them I want it to look like a sausage, a banana, or a hot dog in shape. Again, kids are visual. Kids often like talking about poop, so they'll usually report back to you. It should be easy to pass. They shouldn't be straining too hard. Working towards that is really, really helpful in taking pressure off that bladder in regards to the close proximity, like we discussed before. Time toileting after meals is also a really great strategy. GI doctors recommend that all of the time. So, having your child sit on the toilet for like 10 minutes after big meals, which are usually breakfast and dinner in my household, with a book, iPad, drawing, something that'll keep them busy on the toilet and sitting there for 10 minutes can actually help stimulate a reflux in the gut, which can help promote a bowel movement. Trying to get your kid on a poop schedule could be incredibly helpful. Utilizing some medications may be needed, especially for certain patients with certain neurological conditions where sensation might be needed, a little bit of a pusher. So I like to explain when we're discussing kind of laxative agents to help with poop, there's mushers and there's pushers. Mushers are things that increase the water content in the poop to soften it. Think about Miralax, magnesium-based products. And then there's pushers that help with that stimulation, which can really help with that sensation, especially for kids with sensory processing disorders, ADD, ADHD, autism spectrum disorder. Those I like to utilize mostly in kids are Senna-based products, so X-Lax and stuff like that. You might need to figure out exactly what cocktail works best for your kids to get that daily bowel movement. And then lastly, using protective products can really just help boost confidence, knowing, okay, if I do have an accident, I've got something that'll help me manage that. But I do totally appreciate there are significant financial and emotional burdens associated with needing to use incontinence products. Diapers, underpads, and other supplementary supplies like pads and diapers and wipes and gloves are wonderful, but they can get expensive. And so making sure you have access to those is really important. And then making sure you have access to changes of clothes when needed. Preventing out accidents outside the home is similar, but there's other strategies that can be really helpful, in particularly outlining a plan of action, using to-go bags, toilet mapping, planning your bathroom breaks in advance to help you feel more equipped and confident and ready for your travel, which we'll talk about. Travel must-haves that I like to use with my kids and recommend to all of my patients struggling with incontinence is basically having a go bag with extra clothes, all the incontinence supplies that you think you'll need, wipes, gloves, etc., and having all of that times two. The best defense is a good offense. Having prepped bags can really help reduce anxiety, especially if your child's a little nervous about doing something new or a transition. I personally like to keep an extra stash of all of this in each car that we use. So if I forget to replace my go bag or diaper bag, that there's something in the car somewhere. I always like to pack hand sanitizer. Your child might not even be able to access or reach a, public sink. So having something to clean them and your hands can make everybody feel a little bit better after changing an accident. I also like to utilize wet dry bags. So if you do have an accident and you need to put dirty clothes or a soiled diaper away, that could be helpful. One of my biggest hacks is using dog poop bags for that. They come in really compact rolls. They're easy to pack in your purse, in your fanny pack, diaper bag, whatever it may be, which you can utilize for wet clothes and soiled incontinence supplies. Making sure you have plenty of water and snacks, as you know, every parent knows, is really up there as far as importance goes. I will sometimes forget my cell phone before I forget snacks for my kids because they get hangry. And we certainly want your child to stay hydrated when out and about. Another good hack is making sure your child is dressed for quick access because they might get a sudden urge to go to the bathroom and you need to get them there in time and get their clothes off. Elastic waistbands, so you're not dealing with really complicated buttons or belts. Dresses with maybe a really light brief under there. Simple layers and really just trying to avoid anything too complicated can help your child and yourself feel more confident when trying to get them to the bathroom in time. Planning and mapping bathrooms when out and about can also help you feel more prepared and confident. So, trying to time your travel around times when you think your kid is going to use the bathroom, whether that's pee or poop, can be helpful. Using preventative bathroom breaks is always going to be great. So having your child go to the bathroom before you leave the house, before you go to travel, and upon arriving to wherever you are. Try to think ahead about where bathrooms are going to be located. If you have a long car drive, looking to see on 95 or whatever big highway you are, where are rest stops? Where are bathrooms? Where are a Wawa, a big gas station that might be clean and accessible for your child? If not, I always love traveling with a car potty, something you can throw your kid on and have that in your trunk if you have space to always make sure they have access to that. I think also planning, knowing, okay, dad's in charge of the first bathroom break, I'm in charge of the second one. Just plan ahead. Which caregiver is going to help this child use the bathroom and where, especially that might be gender dependent on where you are and accessibility of a family bathroom or not. If you're using a bus or a train or an airplane for travel, try to use an aisle seat. That's easier for your kids to get out and get to the bathroom quicker. Make sure you know where exit locations are. Reminders are going to be important. However, I really try to say keep the stakes low. Avoid repeated questioning when you're out and about. This really increases anxiety for kids and resistance. I've seen it with my own kids. They always tell me they don't have to go to the bathroom while they're crossing their legs and holding it in. Really try to partner with your child. I always like to say use we so they don't think they're being isolated out or kind of picked on. So, hey, let's take a bathroom break. Mommy has to go to the bathroom. I'd like for you to try with me. Let's do this before the game starts so we don't have to stop the game or stop watching the movie, whatever it may be. Let's try to check in with our bodies. So it gives them a little bit of autonomy over the situation. And then, of course, you're going to need to anticipate accidents. They may revolve around big transitions, sleep disruptions, illnesses. So think about all of this when you're outside and even inside the home. And just again, overall, preparation is going to be the best. A good defense is a best offense. How to respond calmly to accidents takes time. It can be very frustrating when your child struggles with incontinence, even though you reminded them to go to the bathroom, they're doing all the right things. Accidents are stressful for caregivers, but even more so for patients. So just keep that in mind. But just trying to be as calm and supportive as possible really helps reduce frustration, shame associated with this, and is over time going to build confidence in your child. I always say positive reinforcements only. Never reprimand your child for an accident. Really try to avoid blaming and shaming. Normalize the accident. It's going to happen. It's okay. Use very clear, calm, and neutral communication and try to be discreet to protect your child. I always like to say, use we when you're approaching this. Uh-oh, looks like we need to go change. Your body's still learning. It's okay. And next time, let's try to get to the bathroom sooner. Can just be really encouraging words of affirmation and addressing them when this happens. Always be open to adjusting your routine contingent on when and how these accidents happen. And I always like to say, try to decompress with your child privately later. At the end of the day, maybe you guys are having connection time, building Legos together, or playing, or doing stories in bed. Try to think back with your child and ask, what do you think we could do better next time? Try to get their input way associated away from that incident so they've had to time to digest it a little bit, and they might be a little bit more open with you as far as collaborating goes. Creating a support system and implementing self-care is going to be a tool for addressing incontinence in your child that goes way beyond measure. So making sure you've got support from trusted individuals in your life and your child's life can really make a meaningful difference for both your child and you. I would involve the right people in the management of this incontinence. So you utilizing trusted partners in your life, relatives, teachers, babysitters, friends, making sure they're aware your child struggles with incontinence in a discreet manner can really help them address incontinence when it happens with you and also help normalize it for your child. Making sure as well that you are taking care for yourself. This can be very daunting depending on the degree of incontinence your child struggles with. So make sure you're taking self-care time for you because no one is alone in this. And you can certainly not take care of your child if you're not able to fill your own cup. Lastly, to talk about is there is obviously a very big financial burden when it comes to incontinence management for kids. And there are rising costs associated with incontinence supplies. Caring for a loved one with any neurological need, right, brings significant financial considerations as they need more medical equipment, needs, supplies, and this can really add to household expenses over time. Aeroflow Urology, which is a subsidiary of Aeroflow Health, is a leading provider of high quality incontinence and continence supplies, offers monthly supplies of diapers, pull ups, pads, and more at possibly $0 through insurance or Medicaid. What's great is they specialize in navigating the insurance benefits that you have for your child to help make sure that they are getting the most out of their coverage. We are here to support you and advocate for all families while helping to reduce the amount of stigma associated with bladder health and continence care. Your loved one may need to meet certain conditions and requirements in order to get all of their incontinence supplies covered. They do vary by insurance and state, but generally qualifications include having a qualifying medical condition or disability that requires incontinence supplies or continence care, being at least age 3 or older, depending on the state in which you live. You must hold insurance in the state that your child resides, and you have to hold a prescription from their doctor or have a signed certificate of medical necessity. For any additional questions and inquiries, I invite you to go to aeroflowurology.com/CNF for more information. Understanding that seeing products online can certainly be different than utilizing in person. So one of my favorite things that Aeroflow does is we'll actually send you free samples so you can really try out several brands, sizes, and absorbencies to see what best fits your child. How urology at Aeroflow simplifies the process includes that they handle all of your insurance paperwork. This is one of my favorite benefits for my patients, as well as from a provider side. They offer free monthly home delivery with just a one-click resupply confirmation. They send reminders however you want them to, whether that's text, email, or phone call. It can be very discreet and very quick. They provide ongoing updates when your insurance is expiring, so your coverage never lapses. They have incredibly knowledgeable continence care specialists who are probably better than me and help you identify the best product to fit your loved one's needs. I find that this is one of the best attributes of Aeroflow Urology that I get positive feedback from my patients. They coordinate directly with your insurance and healthcare providers like me in order to get all of the necessary paperwork completed. And they also share ongoing educational resources from medically reviewed blogs to posts that help your family stay informed and confident in their care. Okay, any questions so far?
I have so many questions.
Okay,
Um,
let's go.
so this is a hot topic in my household. Because my daughter, who has complex healthcare needs, also struggles with incontinence at night. But we
Okay.
also know that that's related to constipation. How do you navigate finding out how much your child is going to the bathroom during the day when school is in play, right? Because you can't always keep track of it as they get older. They're in elementary, middle school. Are there any tips or tricks? I know, she's had accidents during the day and it's usually around constipation.
Yes.
I think more than anything, what would you recommend? I mean, we've heard this a lot from our community too, that teachers don't always let them go to the bathroom. So
Yes.
it can be a
That
challenge.
is one of my biggest pet peeves, which is hard, right? Because I mean, honestly, I think it was 3 years ago, a lot of my teenagers there was actually like a high school locally that wasn't like closed the bathrooms because teenagers were vandalizing it. I'm sure some of you may have heard of this like on TikTok, which is I luckily I have young kids and teenagers scare me. But there are ways we work around it. What I would encourage you is speak to your pediatrician or your urologist about this. We give out school notes like Oprah gives out free things.
Mhm.
These patients really need to have access to the bathrooms, and I understand there are certainly kids that kind of take advantage of that privilege. But having documentation, and it doesn't necessarily need to be an IEP or 504, depending on what your child has, but just having documentation from a urology provider or even a pediatrician can be really helpful for the school systems. In those notes, I usually focus on ensuring the patient can go to the bathroom at least every 2 hours or as needed, and also keep water with them at all times. And if school is not obeying by that, I tell patients to come harass me so I can go find somebody in the school system to harass, to make sure that they're allotted to. I have some patients that, maybe they have sensory processing and really don't like sharing bathrooms, or they're in the public bathrooms with their friends. There are automatic flushes, things are loud. So sometimes we'll even have notes so they can use like a private teacher bathroom, which most schools will oblige. Depending on the state, obviously, most of them have to, if there is a medical necessity for that. But the other big part of it I see struggling again, and Kim, I forget how old your child is, but some of these kids are just resistant and they don't want to. Either kids are doing bad things in the bathroom, or they don't want to seem like they're cutting out of class or getting attention, draw attention to them needing to go to the bathroom frequently. So some other strategies I'll write in notes to educators is like maybe creating a very discreet sign that they don't need to get a hall pass or anything like that. So like I literally have kids, they throw up like three fingers and that's their sign. Like I'm just going to quietly excuse myself in the back of the room and go to the bathroom. I'm not going to stop your lesson. And just something like that, working with their teachers. I understand not every teacher is easy to work with, but there are strategies like that that are traditionally pretty effective. But then it still is on the onus of your child. I do sometimes have to have real heart to hearts with my teenage patients. Like, I know you don't want to go, but you got to try. And that's sometimes where those Apple Watches, Fitbits, wobble watches, external reminders can be helpful. And then lastly is looking at their class schedule, and just say, okay, look in your schedule so you're not always missing math. Like, is there a 5-minute break here between transition that you're passing the bathroom on the second floor of your high school or your middle school that you can use the bathroom? But really, I overall I would partner with your child's, excuse me, providers to get the appropriate documentation to allow for that.
Yeah, and there are also, I know we've guided many families to the IEP or a 504 that this is a medical
Hmm.
aspect that needs to be documented within those forms. There's a specific section for
Yep.
it in the IEP, and so that is always something that families can do. I want to go back to really quickly. You said that uh, you were talking about who could write the script, right?
Mhm.
To get these supplies. I know in my household it's been complicated. Have I seen urology lately? Should I go through the pediatrician? How long? All of these things. Urology didn't find anything, so we don't really know why this is happening. But so then, do we go back to the pediatrician? Do we still follow up with urology? What do you do in those situations? And is it okay from an insurance perspective and getting these materials covered to go through your pediatrician?
It depends. That's a great question. I have usually if I'm seeing a patient, I will take ownership of that just because I'm so used to adding the correct documentation in my notes that Aeroflow Urology or whatever DME company needs to provide those incontinence supplies. Some pediatricians feel pretty confident in that though. And I've certainly received patients that they're like, oh no, like my pediatrician's taking care of that, which from my standpoint, I don't want to break that if it's working well, right? But I certainly think having a specialist do that is certainly helpful, but it usually will depend on state. So like I know here in North Carolina, I see a lot of patients that their pediatrician is able to sign those medical necessity forms. And then I have some where it needs to escalate to us. So I think it might be a little contingent on where you are. And I also have some pediatrician colleagues of mine that don't feel comfortable doing that, unfortunately, which is hard because this is certainly within their scope. I also understand they're busy, and this is like one of, obviously this is our expertise is dealing with this. So I certainly think a specialist can help with that. As far as how frequently that needs to be done, that is also changing. And so that's also really where the continence specialists at Aeroflow come in handy because I am finding that some insurances, suppliers need documentation like every 6 months
Mm,
versus an annual visit. So again, I would check with the continence care specialist at Aeroflow, but also that might be contingent on where you live. Medicaid and Medicare are getting a little particular about that. So, but how we get around that and are able to fill that is we do a lot of video visit check-in, right? Because unless we're doing imaging on you or labs, like I can do most of my job over video if they're in my state. And again, video visit, obviously laws change by state depending on where everybody is. So, but there's ways around that to make sure that you are getting the required paperwork completed from your providers. But yeah.
that's great. And I know one of our members who joined today said the school nurse can help advocate for students to have access to the bathroom, especially if the student has sickle cell diabetes or other chronic
Yes.
conditions.
Yep.
Parents can call 311 in New York City to file formal complaints.
Awesome.
Typically, I
Great.
think a lot of it, if you have that support from your school nurse, it really goes a very long way and getting teachers on board and the rest of the staff members on board as well. They're great allies.
Yeah. Yeah, thank you. That's great. I would say we love our school nurses. However, here in North Carolina, there's a crazy shortage. Like one of my nurses left clinic to become a school nurse. She's covering like 2 counties.
Mhm.
And again, I'm like, again, incontinence supplies are so important, but I'm like, please go give that kid their insulin at lunch, like stuff like that, right? Like, let's think about this hierarchy here. But I love to partner with them, and they're usually wonderful. And they are the ones that are usually messaging me to give me the state supplied or county supplied documentation that your child might need for incontinence supplies or bathroom access privileges, stuff like that.
Yeah, our school nurses really are what keeps our kids
Angel.
going. They are the angels in our
Yes.
school system. And so, absolutely. I want to turn to more of our kiddos who are more complex and they are not having accidents. They need regular changing. One of the things that we see and hear a lot about are UTIs due to this. Can you explain some, maybe especially for nonverbal children, what are some symptoms that a child does have a UTI? What can we look for? How can we prevent that from
Yeah.
happening as well?
Yeah. Great question. And UTIs are kind of our bane of existence in urology in a bad way and a good way. They happen, they are common. However, when I, as a specialist, am looking at what constitutes a UTI, I had this conversation 3 times this morning in clinic already, but I always expect three things at the same time. And I think this is good education for parents and caregivers. Number one is symptoms. That can look differently for everybody. Expect especially our patients who have serious neurological conditions, right, that are nonverbal, that really maybe have high pain tolerance and can't really articulate something's going on. So symptoms of a UTI could look, and talking about cystitis or bladder infection in particular, urinary incontinence, an uptick in that can certainly be for some instability of the bladder lining. Frequency, urgency, pain with urination, maybe a little bit of blood, maybe some suprapubic pain. And one symptom that I like to talk a lot about is malodorous urine. I see parents every day that are like, my kid's pee smells. My general consensus on that is I don't care. So malodorous urine or smelly pee can happen for so many reasons. One of the biggest ones is dehydration, especially if your child's incontinent and they have really concentrated urine and they have an accident, that oxidizes in the air. So if like your kid struggles with bedwetting, sometimes you have that diaper in the morning, you're like, oh my God, that smells horrible. That happens, right? It can happen from constipation. It can be byproducts of certain things that we ate or drink the next day. So malodorous urine is not always a big telltale sign, even though some parents swear by it and it certainly can, but not always. So generally, I tell my patients if they have any of those kind of lower urinary tract symptoms, but they otherwise look well. There's no fever, no nausea, no vomiting, appetite's good. I usually say for the first day or two, I actually want them to try to just flush it out. double their water intake, increase their bowel management. Often symptoms go away in like 24 to 36 hours, which is great. If not, then we start looking into testing for a urinary tract infection. As far as ways to kind of help avoid that, or kind of all the things we've talked about, plenty of water, right? So the more concentrated that urine is, the more irritated it's going to be. And bacteria can double in the bladder like every 20 minutes. So that's why timed voiding and regular emptying of the bladder is going to be really important.
Mhm.
Constipation management is like the biggest thing for UTI prevention. So, making sure your kid is pooping at least once a day. And usually, when we look back at our kids who have recurrent UTIs, it's like precipitated by I didn't poop for 4 days or big poops. And constipation looks differently for everybody. So it can be small poops, it could be huge poops. 5-year-old girls I see every week in clinic clogging toilets. Pain with defecation, even like multiple poops throughout the day, but maybe they're small. And that's where kind of referring to that incomplete stool emptying, but making sure that's easy to pass and using those mushers and pushers, like I talked about, to kind of achieve that. And then that might be something you need to use for months before your kid is kind of getting back into a routine. As far as management at school, just trying to make sure they are using the bathroom pretty regularly, and your school nurse, again, partnering with that they're hopefully able to help change them regularly if they need that. Again, if your child is dependent on a caregiver assisting with child care, they might have that in their like 504 that there is like a school aide or nurse that's with that. Again, that's usually requiring some kind of partnership, generally with like a urology provider, but sometimes pediatrician to make sure everything as far as documentation for school is needed for that. Um, but, and a lot of parents freak out like, oh my God, I missed a poop. They sat in it for a little bit. That doesn't always mean they're going to have a UTI, but just doing your best, to try to change your child, especially if they're soiled with poop.
Yeah. And I saw in the slides, we were talking about ages 3 and up. Is that the age where it's considered incontinence and we're no longer potty training? Is that the age that insurance will cover
Great question.
size? Is it different
Yes.
insurance to
Yes,
insurance company?
totally. Yep. That is this the insurance generally, especially like with Medicaid, is when they will start kind of covering it. However, I like to tell parents, usually most kids are toilet trained by like 4.5. So I see so many, and which is intimidating, right? Because I see kids, especially so many in the spring when they're about to matriculate into kindergarten in the fall, or in North Carolina, sometimes summer. School starts next week here for some kids. That are freaking out because their 4-year-old isn't fully toilet trained. And it's hard to walk some parents off the ledge, right? Because they assume we see other kids that are like, my kid was toilet trained by 2. I didn't even bother trying till my kid was 3. And I try to use
Right.
that as an example, right? That you know, I, I see so many kids who have developed voiding dysfunction, maybe because they tried to toilet train too early before they got it. So making sure your child's ready, whether that's including like they can physically pull their pants down or their pull up and down. So fine motor skills. They can tell you when they're wet. They show interest in it. So we just kind of did a very gradual introduction. Everybody's watching everybody pee. Doors are open, like normalizing the process before even attempting with our son. And it took a while still. And I'm okay with that. And I'm a specialist, right? So I try to, walk parents off the ledge there. But usually between 4 and 4.5, I would expect most kids who have, the sensation and neurological capacity to toilet train will get there. So I don't freak out, is not red flaggy at all if at 3 your child is not continent. That is okay, but that's just from an insurance standpoint when they're able to help with supplies. And certainly bedwetting isolated is different, like we spoke about last week. Even like at 5 and 6, like if they're still bedwetting, that's still like developmentally appropriate and not a red flag at all in my eyes clinically.
And what would you say are clinicians just going to automatically say, yeah, we're going to refer you to Aeroflow or, an organization like that to help cover the costs and work with your insurance company? Or is that something that patients and families really need to ask for in order to have that covered?
encourage all of my patients to ask, right? I like to, again, especially for patients that you serve, these parents are known amazing advocates, right? So like even as a mom, like I'm always going to advocate for my kid, but I don't think a lot of parents know that. I see kids every week in my clinic that I talk about incontinence supplies through Aeroflow or depending on their insurance coverage. And some parents like are literally in tears because they had no idea that they could get incontinence supplies covered. I completely appreciate the financial burden that this has. So I try to help my patients as much as possible, especially the Medicaid patients who it's just traditionally easier to get things covered for them to make sure they have the supplies or the ability to at least try to get some of them. So I would encourage parents to ask about the potential for that. And even for my patients with private insurances, like we said, that's where those incontinence supply specialists at Aeroflow come in handy because they can really look to see every insurance policy is a little bit different about what they'll cover. There are definitely some private insurances that are really hard to work with that like sometimes don't even cover catheters, which are crazy to me as a urology specialist. But nonetheless, we definitely try to partner with them as much as we can to get as much as covered as possible for every patient.
Yeah, and our family support program as well. Sometimes we have
Great.
resources to connect families. If it doesn't work through that route, we really try our best to try to get families connected to the resources they need or get the financial assistance to get that medical all of those medical devices and
Yeah,
supplies that they need because it is tricky. It's expensive,
so
and there
expensive.
are so many things that you need. Talk to me a little bit about the differences in some of these diapers. So one of the biggest things we see families double diapering. We see families that put mats down. And then they, regardless of even double diapering, they still leak or they're putting underwear on as well. And there's all of these ways that families have come up with to just try to keep the liquid within the diaper. And is that completely unnecessary because there are solutions out there? Or are we still in a place where it's difficult to find the right supplies that you need?
Unfortunately, I would say the latter. I still struggle with this with a lot of my patients. And that is honestly one of the biggest benefits I love about Aeroflow Urology is they will send so many samples, so many brands to figure out what fits your child the best.
Mhm.
Which is hard, right? Because you go from like these youth sizes to these adult sizes,
Yes.
but maybe like your child's body habitus does not even fit an adult small, but there
Right.
is a big gap, right, between the youth XL and an adult small.
Yes.
So um, there unfortunately is like no perfect way, except for I really think trying different brands and different sizes. Um, Double diapering can be helpful. I also really love the pad inserts that can be really helpful. That sometimes insurance can get covered, especially like overnight, right? Like hopefully your child is sleeping through the night. That's the biggest time I see leakage occur is like if these kids are just dumping overnight. So I really love like the disposable chucks too. I'm sure most families utilize so they can at least wash those and try to save their mattress covers and their mattresses
Yeah.
if bedwetting is a big issue. Um, I do have some more of our, and especially for particular kids with certain neurological conditions, like my CP kids who are really spastic,
Mhm.
that those can be some of the hardest to find really good coverage, because maybe their one hip is abnormal, is higher and more spastic, and it's hard to get their leg through a hole in a pull-up, but a diaper works well, but it's not perfect. So, um, parents are incredible and they are innovative and amazing engineers. And I wait for the day that their AI helps us create some really fluid incontinence supply overall. But we just experiment, unfortunately. And so again, I think that's also why partnering with DME companies that will help you figure out what works best for your kids. And sometimes it is just, hey, I'm going to size up, but we're going to use a Sposy or a pad inside to kind of catch that
Yeah.
while they're moving as best as possible to catch the overflow.
Yeah. And I heard you talk a little bit too about the mental health effects and on children, but also caregivers,
Yeah.
and the stress on caregivers. And one of the things we hear a lot is that caregivers are literally breaking their backs to pick up their children, in order to get them from one place to another.
Yeah.
And changing is no different. And it's especially complicated when you add in public places, right? Because they don't make the changing tables large enough for some of our bigger kiddos, and so or adults, right, who need
Yeah.
that when they're out and about. Um, any recommendations that you have for caregivers to keep themselves healthy as well throughout this journey as their children get older?
I think there's kind of two prongs to that, right? I think there's the physical health, again, literally with physically picking your child up, maybe it's out of a wheelchair or helping them up. And then the mental aspect to it. I think mentally, I really try to inform my patients' parents and caregivers is that they're not alone. I think this can be really isolating. Fortunately, I think a lot of them have found online resources like CNF or Facebook groups. So like they can bounce ideas off of changing, how to do public appearances, et cetera, with other families that are struggling with this. As far as physical goes, I sent a lot of like core exercises to working on literal ergonomics as best as we can, online resources to that to some of these families. When I see so many patients who are wheelchair bound, parents get really creative. Like they can fully change their child in that so they don't have to bother with public dirty restrooms that they can't even put their kid on those Kodak,
Yeah.
koala, whatever they are, little things that have like no weight limit. There. So that's why I usually recommend having anything adaptive that they use at home. And those are the parents that are fortunately able to get out and about usually have something under their sleeve, which is great.
Yes.
But I think utilizing again through insurance, respite care, having caregivers, making sure that the actual parents and guardians of these wonderful patients are still making sure they're taking time for themselves. And again, this morning saw a very fragile, short mom carrying her big kid out of his wheelchair like it was nothing. She had the best
Yeah.
biceps I've ever seen. And I was very jealous. And, she did it, bend it at her knees, not her back. And I was incredibly impressed. And so I certainly also learned stuff from these parents every day and caregivers. But certainly partnering as best as they can. And again, I think these online resources and foundational groups have been really, really wonderful for supplementary support, both physically and mentally for caregivers.
Thank you. Yeah, we put in the chat some information about a free caregiver course that we have where you can
Wonderful.
meet caregivers, talk about those things. And then we also put in the chat the link to Aeroflow. So if you need some of these supplies or you just want help trying to figure out what to do with your child, and child's incontinence supplies, and you've battled insurance or whatever it may be, they can definitely help you. So please do click that link and check it out, get connected with someone. I think the best thing we can do as caregivers is to get connected to the right resources. And that just makes our life a little bit easier. And I know they're really committed to that at Aeroflow. So I highly recommend clicking that link, joining our caregiver course. You can meet other parents who have tried all the strategies and share with them what you've
Mhm.
learned here today. But I really do appreciate all of your knowledge, Dr. Akers, because I think this is a pain point. This is a definite
Yeah.
pain point for patients and families, and I think absolutely impacts mental health. It's one of those things that is nagging at all times. And whatever strategies that we can give to patients and families to support them in this everyday challenge, it's really important that we give them all the tools and resources. So thank
Yeah.
you again for your time. We greatly appreciate you.
Thank you.
Again, please check out the links in the chat, and we will also be creating some of this content into some micro educational content to go on Reels, to go onto our website. You can also find this webinar on our website here in a few days. So if um, for those of people who weren't able to attend, they'll still be able to see this content. So we're really excited to share
Awesome.
that with our community. So thank you again and have a wonderful 4th of July, everyone.
Thank you all.
Thank you.